In this paper, the authors examine the impact of a smoking ban in Geneva, Switzerland across different socioeconomic groups. It's important to remember that the primary goal of smoking bans is to protect both workers and the public from the dangers of secondhand smoke. Other impacts of smoking bans may include an increase in quit rates, but these are not the primary intention of these laws. Nonetheless, it is important in tobacco control that we determine if policies have any differential effect on socioeconomic groups and see what steps we can take to improve any policies that we do adopt and implement.
I'm Professor Idriss Guessous from the Geneva University Hospitals, and I'm pleased to discuss with you our work that is published in Tobacco Control. To improve tobacco control, several interventions are recommended. This includes increasing tobacco prices as well as smoking bans. We know that smoking bans may reduce smoking prevalence and increase smoking cessation. We also know that smoking is closely related to socioeconomic status. So our question was whether smoking ban would increase or decrease socioeconomic inequalities in smoking. To answer this question, we used the data from the Bus Santé study, which is a population-based study, ongoing, and we included more than 17,000 participants who fulfilled questions and questionnaires, notably about smoking habits. I will now let Dr. José Sandoval discuss both the methods and the results.
First, we use regression models to assess the relationship between educational attainment and smoking outcomes, as well as to follow the outcomes throughout time. These models were adjusted by confounders such as age, gender, or nationality. We also used two indexes of inequality to quantify socioeconomic inequalities in smoking outcomes in both relative and absolute terms, and you can find more details on the paper on how these were calculated. These indexes were calculated overall and also before and after the implementation of the ban to assess if there were significant changes. We found that lower educational attainment was related to worse smoking outcomes. We also found that there was a positive effect of the ban on these smoking outcomes, but this effect was short-lived with a progressive return to pre-ban levels. In terms of inequalities, we found that these increased despite the introduction of the ban. So the relationship between lower education and worse smoking outcomes had already been described in several other studies, as well as the short-livedness of the ban effect on the outcomes, which had been described in other studies in Italy or Spain, using data concerning a ban which was similar as the one that we implemented in Geneva. However, the main focus of our work were inequalities and studying how did the ban impact on them. We observed that these increased despite the introduction of the ban. If you look at other studies where these were maintained or decreased, what this tells us is that there is a context-specific impact of these smoking bans. If we take all the data into account, it advises to assess the impact of these bans in different contexts so that we can identify which tobacco control measures have higher effectiveness in achieving a reduction of inequalities.